Hello dear friends, how are you doing today? I hope you are doing well. Welcome to a new question about dermatology. A 29-year-old man consults you regarding a rash he has noticed around his groin. It has been present for the past 3 months and is asymptomatic. On examination, a symmetrical rash around the groin is noted consisting of well-defined pink-brown patches with fine scaling and superficial fissures. What is the most likely diagnosis? A. Erythrasma. B. Pityriasis versicolor. C. Secondary syphilis. D. Acanthosis nigricans. And E. Candida intertrigo. Okay, here we have a 29-year-old man coming for consultation due to their rash around his groin, which was present for the past 3 months, and the lesions are asymptomatic. On examination, we can see a symmetrical rash around the groin consisting of well-defined pink-brown patches with fine scaling and superficial fissures. The most likely diagnosis here is erythrasma, and here we are going to explain it. Erythrasma is a superficial bacterial skin infection, generally asymptomatic, flat, slightly scaly pink or brown rash, usually found in the groin or axilla, caused by outgrowth of the diphtheroid Corynebacterium minutissimum, a gram-positive filamentous bacterium that normally lives on their skin. Key features: appearance: erythrasma lesions are well demarcated reddish-brown patches with fine scaling, as we can see in our patient. The skin often looks dry and slightly wrinkled. Location: erythrasma is common in warm, moist areas such as the groin, armpits, inner thighs, toe ribs, and under the breasts. Symptoms: erythrasma is usually asymptomatic or it has mildly itching, but it does not cause pain. Of course, it's chronic and slowly progressive if remain untreated. Here we can see the lesion of erythrasma in axillary area of this patient. Here we can see also erythrasma under the breast of this patient. You can see also their pinkish or reddish lesions of erythrasma on axillary area of these patients. Here we can see the erythrasma lesion on groin of this patient. Risk factors: diabetes mellitus, obesity, hyperhidrosis or excessive sweating, warm, humid climate, and poor hygiene all are risk factors for erythrasma. Diagnosis: Muslim examination. The affected area fluoresces coral red due to porphyrins produced by the bacteria. A microscopic culture rarely needed unless the diagnosis is unclear. As we can see here, we can see the coral red lesions of erythrasma under the examination of Wood's lab, and here we can see the coral red lesion of erythrasma under the examination of Wood's lab. Differential diagnosis: tinea cruris or fungal infection of the groin, candidiasis, intertrigo, and psoriasis or eczema all are the differential diagnosis of erythrasma. Treatment: topical antibiotics like fusidic acid, clindamycin, or erythromycin are topical antibiotics for erythrasma. Oral antibiotics for extensive disease like erythromycin or clarithromycin are helpful. Adjunctive care: keep the area dry, improve hygiene, and manage sweating and control diabetes. In conclusion, erythrasma is a chronic superficial bacterial infection common in skin folds characterized by reddish-brown patches with coral red fluorescence under Wood's lab and treated with topical or oral antibiotics. Okay, this was a short explanation about erythrasma presentation and management. Thank you for your attention.